Welcome. I'm endocrinologist Dr. Akshay Jain in British Columbia, Canada. Out of the dozens of medications currently available for the management of type 2 diabetes, metformin is probably one of the oldest medications and the most commonly used. It is an inexpensive, generic medication that is available around the world, and in most instances, it is the first medication that doctors prescribe when someone is newly diagnosed with diabetes. Metformin has not only been used for diabetes, but can also be used for pre-diabetes or borderline diabetes, as well as for the management of PCOS or polycystic ovarian syndrome. Despite being a very commonly used medication, many people experience side effects from metformin, and in today's video, we will chat about how to overcome these side effects. A quick note, please do not forget to subscribe to my channel for more such videos and hit the like and share button if you find this video very helpful. Let's chat about the most common side effect of metformin, gastrointestinal symptoms. Now, this is an umbrella term that includes symptoms such as diarrhea, nausea, vomiting, acid reflux, bloating, or abdominal cramps, among others. Gastrointestinal side effects are probably the most commonly occurring side effects of metformin. Studies show that side effects of metformin can occur in up to 30% of individuals taking metformin. These gastrointestinal side effects can be of varying magnitude from mild all the way to significant. Today, I'm going to give you my 5 top tips for overcoming diarrhea and other gastrointestinal symptoms on metformin. Tip number 1, start low and go slow. Metformin is available in various dose strengths, and the daily dose can range from 500 milligrams all the way up to 2,500 milligrams. It's extremely important to note that the side effects of metformin can occur if the dose is escalated too quickly. I would generally recommend initiation on half or 1 full tablet of 500 milligrams once a day for 7 to 10 days, and then gradually increasing the dose by half to 1 tablet at a time until you reach the prescribed dose as recommended by a doctor. While escalating the dose, should you develop side effects of metformin, you can always consider decreasing the dose, stay on the lower dose for a few more days before attempting to re-increase the dose. Tip number 2, find your metformin size. Just like all of us have a shoe size, we have a metformin size. Allow me to explain. We may all have a certain threshold of daily dose of metformin that we can tolerate before the side effects occur. And if despite only slowly increasing the dose of the metformin as recommended previously, if you're still getting the side effects, it's likely because you have exceeded that total daily dose of metformin that your body could tolerate. In such instances, I would not necessarily say that the metformin needs to be stopped altogether, but sometimes using that lower dose and continuing on that ongoing will still give you the benefits of the metformin in your body, and you will still be able to tolerate, which is much better than not using the medication at all. Studies show that the side effects of metformin are dose dependent, and hence, if the dose of metformin is reduced, the side effects may subside. Tip number 3, a full stomach equals lower risk of metformin side effects. Our stomachs can be very sensitive to the metformin, and it's absolutely essential that the metformin be taken after a meal. Taking the metformin on an empty stomach can exacerbate these gastrointestinal side effects, and a simple modification of consuming the metformin after meals can greatly lower the frequency and intensity of these gastrointestinal side effects. Tip number 4, change the formulation. Not a lot of people know that sometimes the side effects of metformin may not be related to the actual medication, but rather the binders that are used to formulate the tablet. A binder is basically a chemically inert substance that pill manufacturers use to give volume to the tablet and help with the delivery of the pill to the part of the gut where it is absorbed. I've had patients who developed the side effects of metformin and were previously tolerating the metformin quite well. But when they switched over to a different generic manufacturer, or went from a name brand metformin to a generic version of the medication, they suddenly develop these side effects. If you suddenly develop side effects on metformin, speak to your pharmacist to find out if your metformin brand or the manufacturer has been recently changed. The majority of metformin that is prescribed is the immediate release or the regular metformin. This is the most inexpensive version of the medication, and it is generally taken 2 to 3 times a day. However, this version has a very high likelihood of side effects. When individuals having side effects on the immediate or regular metformin are switched over to a different formulation called the extended release or long-acting metformin, up to 55% of these individuals may notice that their side effects are completely resolved. Another benefit of the long-acting metformin is that it is to be taken only once a day, thereby reducing the likelihood of missing your pills. Speak to your doctor if switching over to longer-acting metformin might be the appropriate step for you. Tip number 5, is it really the metformin? Most of us may have experienced these gastrointestinal symptoms at some point of our lives. These can also occur while we are on metformin, and hence, it's important to determine if the symptoms are really from the metformin or occurring just because of other reasons. I would suggest a simple 3-step test to determine if your side effects are indeed from the metformin. Step number 1, time correlation. A symptom can be correlated to a medication only if it occurs after starting the medication. Although side effects of metformin can occur generally in the first few days after initiating or escalating the medication, it may occur even after an extended period of time. However, a side effect is unlikely related to the medication if you're having diarrhea even before the metformin was started. Step number 2, stop and observe. If the side effect is due to the metformin, then stopping the medication should lead to resolution of the symptoms. If you continue to have diarrhea despite stopping the metformin, then the diarrhea was unlikely to be related to the metformin. Step number 3, the re-challenge. This is probably the most crucial step. If the diarrhea stopped after you discontinued the metformin, restart the metformin to see if the diarrhea reoccurs. If it does, it is likely due to the metformin. Of course, while restarting, make sure that you start at a low dose and then gradually go up as previously discussed in this video. I've got a bonus tip for you. For those individuals who are on extended or long-acting metformin, do not crush, break, or chew the tablet. When taking the long-acting metformin, you may notice that the pill or a part of the pill shows up in the stools, but it is important to note that this is only the casing or the covering of the medication, and the actual medication has already been absorbed in the gut. Hence, noticing it in the stool is nothing to worry about. Despite the above tips, some people may continue to have side effects of metformin, and if this is the case, talk to your doctor about using a different medication instead. Also, a lesser known side effect of metformin is that some individuals on metformin may experience low vitamin B12 levels and may require supplementation with vitamin B12 supplements. Thanks for watching the video. I hope you found this helpful.